You're recording.
Hi, this is your EMS rapid review for EpiPens, and what we'll be doing today is discussing about the indications, contraindications, considerations, and use of an EpiPen. So the first thing we want to do is make sure that we have the proper indications for use of an EpiPen. And those are a patient who exhibits signs of a severe allergic reaction, which may include respiratory distress, irregular heart rate, rapid heart rate, hives, edema of the face, mouth, neck, and or tongue, hypoperfusion, and a loss of consciousness. And in addition to those things, we also have to make sure that the pen belongs to the patient, is prescribed to them, or is cared for by the agency for use in the emergency situation of severe allergic reaction. Other things that we want to make sure that we have are a lack of the contraindications, and the only two contraindications in the setting of a severe allergic reaction are an expired EpiPen and the inability to determine if the EpiPen belongs to the patient or is expired. So as we go through our care, what we want to do is make sure we go through our scene size up and initial assessment. We want to support the ADCs. Are you breathing okay, Marta?
I am.
Okay. We also want to provide oxygen as necessary, and in the horrible event that the patient doesn't have a pulse and is not breathing, we want to make sure that we do CPR. So, those in mind, we want to make sure that we have the three rights. We want to make sure that we have the right medication for our patient, and this happens to be an adult EpiPen, and adult EpiPens are patients over 60 pounds. Those less than 60 pounds need an EpiPen Junior. So Marta's a little over 60 pounds, so she'll be using an adult EpiPen. We want to make sure that we have the right route. This is an intermuscular injection, and the appropriate place is on the upper 1/3 of the thigh, on the outside or lateral side. We also want to make sure we have the right dose. Because we've made sure that we have an adult EpiPen, we know that we're okay administering it to Marta. So the first thing we want to do is make sure that Marta knows what's going on. Marta, what I'm going to do is, it seems like you're having a hard time breathing, having an allergic reaction. We want to give you an EpiPen. But before we do that, do you have any cardiac history that we should be concerned about?
No, I do not.
Any cardiac arrhythmias? Anything that we should be concerned about as far as heart disease?
No.
Okay. If Marta did have those occurrences, we'd want to contact medical control and make sure that we had the right patient for this medication. We don't want to give it to them if they have those problems. Okay, so what I'm going to do is, if I have time, I'll nip a little hole in her pants, take an alcohol swab, and clean it off. The EpiPen will actually go through the pants. Since Marta's in some significant distress today, I think we'll probably just go through her pants and give her the EpiPen. So the first thing I want to do is pull the gray safety cap off. That cocks the tool. That make sure I don't put my hand in front of the black indicator tip, which holds the needle. I want to place it over the thigh and give it a little poke in the spot that I've indicated. So we'll do that, and we'll hold it in place for 5 to 10 seconds. And you can hear a little snap. And one of the things you have to do, and I probably should have done beforehand, is tell Marta to stay nice and still, because it may be a little uncomfortable to wiggle around with that in. Okay, we've gone for about 10 seconds. I'm going to remove it. The needle stay protruding. I want to place it in a sharps container and put it away and keep it, because we'll transport with it. And of course, at this point, anytime I give medications, I want to do an ongoing assessment, take my vitals, assess how the patient is doing. An EpiPen will last anywhere from 10 to 20 minutes. If the patient has recurring symptoms within that time frame, I'll need to administer an additional EpiPen, or if she doesn't get relief within the first couple minutes, I want to make sure that I administer a second EpiPen to make sure we get relief for those symptoms. Once we've administered it, we want to take the EpiPen with us. We want to facilitate transport for Marta to the hospital so she can get definitive care, and we'll make sure that everything goes well. Thanks very much.